as I second, to begin by saying, and we have agreed that the success or failure of devolution in this country will be based on how we manage health sector. And now that the majority leader, the distinguished Senator of Kericho, and my neighbor, Senator Aaron Cheruiyot Kipkurui, is called Telwa in some other circles in the village, Mr. Speaker, is called Telwa. Telwa in some other circles, Mr. Speaker, sir. It's an honor, and I was in that stadium, in Kiprukut Stadium, in Kericho, when we launched the community health promoters, and I felt the pride. Because, Mr. Speaker, you know, even today in Wajir, in Salmalmak location, in Diffward, in Wajir South, in Wajir County, the elders there called me today and they are complaining for lack of drugs in Wajir County despite receiving 12 billion. Mr. Speaker, we have spent many minutes and hours here discussing about 1 billion expired drugs that is with KEMSA, Mr. Speaker, and mostly are cancer drugs, they are malaria drugs, they are HIV and AIDS drugs. And most of these drugs, Mr. Speaker, are drugs that should assist Kenyans. Mr. Speaker, for us who are village senators, we attend a number of funerals over the weekend, and most of our people are dying because of cancer. When you hear KEMSA is losing 1 billion to expiry of drugs, involving cancer drugs, Mr. Speaker, some of us feel like crying. And I'm disappointed because this is the OAG report which did the report. But, Mr. Speaker, we hope and believe that for the last 15 years, 4 trillion Kenya shillings have gone to our counties. We are yet to see the value of that 4 trillion Kenya shillings, Mr. Speaker. I'm aware the budget has just been read today by the CS of National Treasury, Mr. Speaker, where we are going to give counties 428 billion, an additional 13 billion from 415 billion. We want this money to give value. Mr. Speaker, yesterday we did move the county government's additional allocation bill. And let me begin from there, Mr. Speaker. The community health promoters received 3.2 billion in terms of stipend. I'm happy the majority leader, while moving, Mr. Speaker, has indicated that this is a stipend, Mr. Speaker, because the minimum wage of this country is 18,000. So if the national is paying 2,500 shillings and the counties are paying 2,500, which is normally late because of late exchequer releases, and the ministers of national treasury since 2013 have always violated Article 219 by delaying disbursement of cash to our counties, Mr. Speaker. This issue of remuneration, we must look at it. I agree this could be stipend. It means a lot. 5,000 means a lot for somebody who wants nothing. But that one should not allow us to violate Article 41 and Labor and Relations Act. I'm happy the majority of the leader, who is the mover of the motion, has indicated that this is just the framework. This is the baseline. This is the foundation where we'll be able to come up with remuneration for our community health promoters, Mr. Speaker, because we don't want to suffer like ECD teachers. Even from Nandi, Mr. Speaker, my ECD teachers are scheduled to go on a strike. Mr. Speaker, we should not subject employees working for counties at the mercy of governors, Mr. Speaker, who don't see the value of those people. Yet you still find ghost workers in a number of counties. You saw Uasin Gishu County has around 765 ghost workers, according to financial year 2024-2025, which are used for political expediency, Mr. Speaker. So in Nandi, for example, Mr. Speaker, under this financial year of 26-25, because I'll be very brief and efficient, Mr. Speaker, Nandi is going to receive 96.60 million towards community health promoters in the county government additional bill as per Article 202 of the Constitution of the Republic of Kenya, Mr. Speaker. So, Mr. Speaker, out of 3.2 billion, 96.6 million will go to Nandi to support. Mr. Speaker, my only request is that let us ensure timely disbursement so that as the national government gives 2,500 shillings, the counties are able also equal to give 2,500 in good time. 5,000, Mr. Speaker, I highly doubt, because I know the Don Abdi of Garissa cannot eat 5,000 for lunch. 5,000 is when you go to Serena or Kempinski, Villarosa, and I saw my brother Senator Aldama was in France. I don't know whether 5,000 will be enough for the king of Ma to even have some salad in a very high-end restaurant somewhere in France, Mr. Speaker, or in the streets of Paris, Mr. Speaker, especially after visiting the Eiffel Tower in somewhere in France, Mr. Speaker. So I agree with the majority, and I hope, Majority Leader, when we pass this, we must come up with how we can ensure they are remunerated, because I know Senator Chute, who is my very good friend, also have similar concerns. We appreciate, Mr. Speaker, and I'm happy, because I'll only make 3 points. My second point is I'm happy that these community health promoters, we have been provided for under the second schedule, that their work is community health, Mr. Speaker, psychology, counseling. Mr. Speaker, I want to add, if it is not too much trouble, and request Majority Leader, who was the ear and eyes of the President, to also ensure community health promoters visit some of our schools so that they can be able to provide psychology and counseling to our children who continue, a number of them, to ban schools and school unrest and strikes, Mr. Speaker. It is important, Mr. Speaker, especially women in home who have just passed, it's called, when there is a name that is normally said when a woman has just delivered, they sometimes have depression. I think this is very important on psychology and counseling. Mr. Speaker, on community health, you know, a number of our people suffer because of preventable diseases. Just ensuring that water is well treated, ensuring cleanliness. Mr. Speaker, did you notice when we implemented fully the issue of cleanliness, the issue of wearing masks and sanitization, a number of diseases in Kenya just flew away, Mr. Speaker. Even cough, the issue of sickness because of poor handling of food came to an end. So community health promoters will be, even social work, Mr. Speaker, I am happy, Mr. Speaker, will ensure that social work works. There is the issue of community HIV counseling and testing, which I know with the USAID, Donald Trump, and the issue of supply of the anti-HIV drugs has been a problem in this country. But, you know, I feel sad that the 1 billion, that, you know, the other day we were complaining, Mr. Speaker, that there was lack or inefficient supply of HIV and AIDS drugs in the country. But it is very unfortunate that it has expired in KEMSA, that 1 billion worth of drugs, some of them were involved. Even immunization to our children, Mr. Speaker, you have to appreciate, Mr. Speaker, some of us were born at home. And we thank God that we survived, Mr. Speaker, because we used to have those women, the midwife in the village. They dealt with our matters properly. Some of us were even kichwa ngumu, even during our birth. So, Mr. Speaker, you can imagine the midwife had a lot of work, Mr. Speaker, and you find most of our children, and for us village senators, most of our mothers still give birth in the village setup. And there are midwives, even I know in Marsabit is similar. So most of our children are not immunized in the village. So this one will assist. And also say, Mr. Speaker, you can imagine somewhere in Digir, a mother has to travel maybe to Digir town or all the way to Narok town to get immunization. You can imagine the transport, they have to carry the young baby. But if you send the community health promoters to do immunization, Mr. Speaker, it will be easy. I don't know whether it is different in Makueni. For us who represent rural counties, even Siaya, where they distinguish the king of ODM and ODM party leader, agree with me that immunization, we must send the community health promoters. They can even weigh and advise, Mr. Speaker, on nutrition to our mothers, the new mothers, Mr. Speaker. But I know Senator Muma will be in better place to explain such, because having undergone through motherhood, then she understands better. Community development, Mr. Speaker, is very critical. Health education is very critical. Any other relevant training as prescribed by the Cabinet Secretary. So, colleagues, this is what the community health promoters will be all about, Mr. Speaker. The aspect is just to establish the council that will ensure. This will be my third and final point, is to assess the qualifications of community health promoters, maintains improvement, and ensure there is professional code. Mr. Speaker, we are aware most of these CHBs will work around our houses. We also have a professional code. We must have discipline, because we don't want people who might not have good habits to go to people's home and maybe steal or misbehave, Mr. Speaker. So I'm happy that this council, that the mover of the motion, Majority Leader, has indicated, will ensure that there is code of profession, because every profession must have a code. There should also be qualification, disciplinary measures, professional code, register and keep record of all, and even the issue of disciplinary, Mr. Speaker. And I'm happy, Majority Leader, that there is collaboration between Kenya Medical Practitioners and Dentists Council, KMPTC, The Center Board of Health and Clinical Officers, KUCO, will also be part, and also Nursing Council of Kenya for standardization and professional that we ensure. And also the advice, Mr. Speaker, I don't know whether the majority leader will allow us in the third reading, in clause number 5, to include also the assessment and setting of issue of salaries and remuneration for community health promoters. Mr. Speaker, on the issue of the establishment of council, I know members know you must be a man of integrity and all those issues, so I don't want to be devil because it is mutatis mutandis in a number of laws that we have. Even the powers of council are the same, the tenure of office, Mr. Speaker. The issue of allowances is set by SRC, which is a norm as advised, Mr. Speaker, and I think it is very important. The issue of registrar will ensure that its records are kept on community health promoters and particulars of the register, Mr. Speaker. On the issue of disciplinary and the issue of courses that will be prescribed, that will be done, Mr. Speaker, as the second schedule by, Mr. Speaker, I'm happy, and allow me to say this, that even in this budget, I have seen a number of constituencies, almost 290 constituencies in our counties, are going to have KMTC, Kenya Medical Training Colleges. I'm happy, Mr. Speaker. Even in Nandi, I think we have 2 or 3 KMTC all over the country. This will allow to ensure that our sons and daughters are trained in the KMTC for these courses so the approval and in their villages and registration, Mr. Speaker. And I'm happy in this budget that Honorable Mbadi has just read is pro-mwananchi budget, Mr. Speaker. I know it is the highest 4.8 trillion Kenya shillings. We hope to see KMTC being constructed so that courses are affordable, Mr. Speaker, and appeal to Higher Education Loan Board now that I've gone 3.7 billion to ensure our children in KMTC are also getting loans like you, like me and Manzo. We were able to get Higher Education Loan Board when we went to university. Why is it that KMTC students should get loans so that we can ensure? We also want to see, even in teachers training, Mr. Speaker, are you aware our students in teachers training are not getting loan than like the university? I think that is violation of Article 27 on discrimination, Mr. Speaker. So, Mr. Speaker, with those very, very many remarks, Mr. Speaker, yes, Mr. Speaker, I think as Senator Chute, I don't know whether he's holding brief for the majority leader, but also to ensure that we are protected in terms of those KMTC. If they read, Mr. Speaker, our girls also will get opportunity to study because there is what we call female power. And we want the female power to be felt in the boardroom, in the villages, and of course in the bedrooms as usual. Mr. Speaker, with those many, many remarks, let me end there and second and say this is a very important bill that we must support as a House. This is a bill that we must support as a House. In fact, this is the only bill, Majority Leader, that I am proud of National Assembly. On others, they are getting 99.9%. But on this bill, I agree for the sake of community health promoters, which is 100,000 plus across our country. And we thank the President for that wisdom, for that, Mr. Speaker. Our President is always ensuring that there is development. And I think this was his idea, Mr. Speaker, that we have CHPs in our counties. Mr. Speaker, with those many remarks, I would also want to listen to colleagues, including the King of Ma, Senator Ledamo Lekina, Mr. Speaker, to speak some wisdom. I beg to second and yield the mic. I thank you, Mr. Speaker, sir.
Honourable Senators, I propose the question that the Community Health Promoters Bill, National Assembly Bill number 53 of 2022, be now read a second time. Honourable Senators, I shall allow members to debate, and just to get concurrence from the House, if we should put a limit to the time. Is 5 minutes okay for each? 5 minutes, very well. I'll start with the Majority Leader. Senator Oburu needs to contribute. He's the first on the list.
Give him 10 minutes.
Senator Oburu.
Wisdom.
Power.
Thank you. Mr. Speaker, sir,
Yes.
thank you very much for the opportunity to contribute to this important bill. Mr. Speaker, some of us who are born in the rural areas and stayed in the rural areas know the importance of these primary health care workers. The primary health workers, Mr. Speaker, sir, are the ones who take care of the ordinary person when they get any disease which is inexplicable, which they cannot use traditional medicine to treat. They fall in the hands of these community health promoters. And the concept of community health workers came from the Bamako concept, when medics sat and agreed that there need to be a formalization of community health workers who take care of primary diseases at the primary level, at that low level, Mr. Speaker.